I'm happy to be joined now once again by Trinity Health of New England's Dr. Syed Hussain. Dr. Hussain, good morning. How are you?
Good morning. I'm great, Tim. Thank you.
Glad to have you here. Okay, we've gotten two viewer questions in, one of which we've gotten before, but I think it bears repeating. A viewer wrote in to me to ask, hey, how much time do you think there should be in between getting a COVID shot and the flu shot?
So, yeah, that's a great question. So initially, when we started this vaccination campaign, there was a 2-week recommendation from the CDC, which since has been waived, which means you can take both the COVID shot and the flu shot at the same time on the same day. So it makes it easier for folks. The only thing I want to remind viewers is that if you do have symptoms suggestive of COVID, or if you indeed test positive for COVID, then it's important that you wait the 10 to 14-day period before getting the flu shot.
Part of the public health messaging campaign, you see it sometimes on billboards talking about what percentage of people hospitalized with COVID in Connecticut are unvaccinated. And previously, one viewer wrote in to say, I saw that number be over 90%, but lately the state said it's now only about 75%. He wanted to ask, why the change?
So this is a very important scenario, and I'm glad you asked. So a few points on this. So we know, first and foremost, we know that these vaccines are highly effective and safe, but they were designed to prevent severe disease and death, and they do a great job in doing so. Now, as this contagious Delta variant has spread, we've seen more breakthrough infections, which is not surprising. Remember, these vaccines, while effective, and in the studies showed that they were anywhere from 90 to 95%. So we expect some breakthrough infections to happen. The probability is around anywhere from 1 in 5,000 to anywhere to 10,000 people that may develop a breakthrough infection. Also, it's important to look at the demographics. Who's getting these breakthrough infections? So if you look at data from the UK or Israel, real-time data, it's more individuals that stood first in line to get the vaccines when the vaccination campaign started in December 2020. Those are individuals above the age of 60. So which also has now started a discussion, prompted a discussion on booster dose. And that's why you saw the White House come out with the statement last month saying we should get ready for a booster dose in September.
And speaking of, just from an epidemiological perspective, what do you think is best for the United States? Granted, both of these things I'm about to say are good, but it sounds like we have to choose. Should we use these extra doses to give Americans booster shots, or would it be in our best interest to try to get more shots to other countries to maybe tamp down the possibility of other variants emerging?
So I believe we can do both. The U.S. ordered 1.4 billion doses from the 3 currently licensed vaccines. We've administered over 390 million doses. We're expecting more doses to be delivered by the end of this year. So we have a comfortable supply for our own use, but we need to help out other nations as well. Remember, we're all in this together, and we need to ensure that the virus stops replicating and mutating into different variants.
I want to go back to what you had said before in your previous answer, that some of that real-time data from the UK and from Israel showed that a lot of these breakthrough infections were coming from some of the older people who were also first in line to get their doses. To me, I'm inferring that means maybe waning immunity might be an issue. And it still seems like that's a very hot topic. What is the latest science showing us with that?
It is a hot topic, and there is a lot of discussion and debate going on. We await further guidance from the CDC and FDA that are looking into this, but it does appear that there might be some waning of immunity, hence those individuals are more susceptible. Now, is a 3-dose vaccine totally out of the realm of things that we see? No. We have vaccines currently that are licensed, for instance, hepatitis B, that is a 3-dose vaccine. So, and again, this is new territory for us when it comes to dealing with this virus. So it remains to be seen whether going forward 3 doses will be what is required to keep immunity levels at a good rate level, or will we look at an annual booster dose?
Okay, and that's just something we will have to monitor as the science develops. Dr. Hussain, thank you so much for taking the time again to join us to answer some of those viewer questions. We do appreciate it.